guys, we are from group 3. We'll demonstrate a vein blood drawing tutorial.
My members are Alfiah, Rindi, Antika as a receptionist, Andreana Saphira as Medical Laboratory Technologist 1, Anggi Permana as a patient, Cindi Novita Putri as narrator, Gabriella Samantha as a Medical Laboratory Technologist, and Resta Amelia as a Medical Laboratory Technologist 2. Now I will explain the definition of venipuncture. Venipuncture is the puncture of vein as a part of a medical procedure, typically to withdraw a blood sample or of an intravenous injection.
Okay, now I will tell what tools will be used in sampling. We use personal protective equipment such as lab coats, hand scones, and masks to protect ourselves when taking samples. Tourniquet to stem blood to make the veins clearer. Syringes to take venous blood. Alcohol swab to sterilize the stabbing area. Gauze to hold the blood out after stabbing band-aid close the puncture wound. Now, the patient will go to the registration section to fill out the sampling request form.
Sir, is there anything I can help?
Yes, I want to do a blood test.
Okay, first you must fill out this request form.
Okay.
After this, the laboratory official will direct the shirt to the for laboratory sampling.
Okay, thank you.
Thank you. Okay. Hello, Mr. Anggi.
Yes, I am.
Come on, sir. We are going to the laboratory for sampling. Please sit down, sir. Hello. Yes, this is form for the test. Okay, thank you. Mr. Anggi Permana, what is your full name?
Alright.
Okay, can you spell your full name?
Yes, I can. Angipermana.
Okay, how old are you, sir?
19 years old.
Okay, do you want to do a blood test?
Yes.
Use lab squads, and before I use personal protective equipment, I want to wash my hands. handphone. Has that place open next week?
Select a suitable site for venipuncture by placing the tourniquet 3 to 4 inches above the selected puncture site on the patient. Do not put the tourniquet on too tightly or leave it on the patient longer than 1 minute. Next, put on non-latex gloves and palpate for a vein. When a vein is selected, cleanse the area in a circular motion, beginning at the site and working outward. Allow the area to air dry. After the area is cleansed, it should not be touched or palpate again. If you find it necessary to reevaluate and site by palpation, the area needs to be re-cleansed before the venipuncture is performed. Ask the patient to make a fist. Avoid pumping the fist. Grasp the patient's arm firmly using your thumb to draw the skin taut and ensure the vein. Swiftly insert the needle through the skin into the lumen of the vein. The needle should form a 15 until 30 degree angle with the arm surface. Avoid excess probing. When the last tube is filling, remove the tourniquet. Remove the needle from the patient's arm using a swift backward motion. Place gauze immediately on the puncture site. Apply and hold adequate pressure to avoid formation of a hematoma. After holding pressure for 1 until 2 minutes, tape a fresh piece of gauze or band-aid to the puncture site. Okay, sir. Now you can wait in the waiting room for the test result. Thank you. Here is a video tutorial on taking venous blood from us. Hopefully this video can help friends in taking venous blood. See you!